worry stops where faith begins. But I came across that quote years ago when my sister passed away. And I had to stop worrying about my next steps because she was such a mentor to me. And when I started to walk in faith and not worry, that really helped me with my next steps and my confidence in being courageous.
Welcome to the Health Science Coach Podcast. My name is Drew Garner, and I'm a health science and physical education teacher. This is a podcast to help students, parents, and recent graduates learn about pathways into healthcare and sports medicine careers. These industry professionals lay out how their experiences have helped them get to where they are now. If you enjoy this content, please subscribe to the channel or download through your podcast player. Thanks again for spending some time with us today. Now let's dig in. Today we get the pleasure of meeting with Brittaney Jenkins. She is a certified health education specialist and public health consultant. Brittaney, welcome. How are you doing today?
I'm good. Thank you so much for having me.
Absolutely. Thanks for coming on and spending some time with us about what you do for public health.
Yes, no problem.
Can you give us a little detail about your career and what you do as a health education specialist?
Yes, of course. So I am a public health consultant, and I help nonprofits and for-profits to develop innovative community outreach strategies that increase awareness of their program, increase engagements, and also leads to financial opportunities like grants. I also run a 4-week public health mentor program, and that's for individuals who are current or aspiring public health professionals that are looking to accelerate in the field.
Okay, that's pretty cool. And you recently just started your own company, full-time Jenkins Public Health Consulting.
Mm-hmm.
What does kind of a day in the life or a week in the life look like?
Yeah, so I've been running this company since 2018. But a day in the life is working with companies, nonprofits and for-profits, and doing a strategy session. And that's when we audit their program. We look at the challenges they're facing, the opportunities that may arise for them, and then we create a outreach plan. We also do a communications calendar for them to work with their communications outreach strategy and so many other things.
Yeah, that's pretty exciting.
Yeah.
And so you studied your undergraduate at Ball State University, and you have your bachelor's in public health and science and interpersonal relations. How did you choose Ball State, and what did that program kind of look like for you?
Yes, so upon graduating high school, I actually went to Indiana State University first, but I was pursuing nursing, and their nursing program had some challenges, so I transferred to Ball State University. And at Ball State University, I also was pursuing nursing, and during my internships, I realized I wanted to help patients that were sick, but helping them prevent their sickness and diseases and injuries. Because once I was in the hospital, it was just so emotional for me. And I knew there was something bigger to do to prevent these injuries and diseases. So that's when I looked into Ball State's public health program, health education and promotion program. And it was just really something that spoke to my heart as an individual when it comes to, changing lives, helping individuals and connecting individuals to resources. So that's what led me to public health. And I had some amazing professors at Ball State University that I am still talking to this day through LinkedIn. And they really encouraged me to really go down this field, this line of work for sure.
Yeah. So as far as public health, what does as for public health, you're saying you connect people with programs and sources. What is the kind of just a big picture of what public health is?
Yeah. So we are primary and secondary prevention. So that means we're doing education, and then sometimes there's some vaccines in there, right? So we're educating people about preventing diseases, preventing injuries, how to keep your health up to par. I'm really focused on chronic disease and injury prevention. So we're doing smoking cessation programs. We're doing different type of nutrition programs, cardiovascular health, etc. We're doing all of those things. Right. And then also there's some initiatives on testing your A1C levels, again, giving some types of vaccines, like talking about the flu vaccine, etc.
Yeah. So you have some certifications. You're certified health education specialist. What does the testing look like for that? And is that something that is a part of the college curriculum, or is that something that you do after your degree?
Okay. Yeah, so it is something that you do on your own after college. You can actually take it during I think your senior year of college, and you get a discount on the exam, which it's a $300 exam depending on when you register. So I highly encourage people who are the last year of college to take the Certified Health Education Specialist exam by NCHEC. And that exam really helps you stand out as the ideal candidate when you're applying to a public health position. There's a lot of, misconceptions on if it's necessary, if it's not, and I think it is. I really think that helps you stand out, and it gives you a unique perspective or a unique opportunity to negotiate your salary. There are classes that you take in your undergrad program that helps you prepare for that exam, but there's also additional educational materials that you can purchase through NCHEC, the National Commission for Health Education Credentialing, for you to take that exam.
Yeah, that's cool. And you're also from University of Central Florida, have your diversity, equality, and inclusion for the workspace certificate. What does that kind of help allow you to do as far as work related with public health?
Yeah, that was an amazing opportunity. I believe it was like 12 weeks online, and they offered that to like the first 1,000 people in the United States. And one of my old mentees who were part of my public health mentor program, she sent me that opportunity and I signed up right away. And that was amazing for me to experience because it talked about a lot of the biases and stereotypes that we have that could be preventing people from the help that they need or serving your team as a leader effectively. So that really, really helped me to learn more about diversity, equity, inclusion, and how I myself could really do better as a leader, as a friend, as a family member.
Yeah, that's pretty interesting. So, I mean, especially with working in the public health, you work with all different types of people in the communities that you're in. And so being able to understand the different aspects of what they're going through is probably pretty important.
Exactly, yes. We can't assume their needs. I think that's a big challenge with public health programs. We're working towards doing better with not assuming or generalizing the needs of that population, but really having those community members at the table to help us assess and develop those programs and also help us with the outcomes of that program to the evaluation stage.
Okay. So when you got out of college, you did an internship for the Delaware County Public Health Department in Indiana. What was that kind of experience like, and what did you learn that you were able to take with you to your next job?
Yeah, so the Delaware County Health Department is in Muncie, Indiana, and I did that during my senior year at Ball State University, and it was a life-changing experience. I had a great leader at the health department who helped me accelerate and understand the importance of all the different topics in public health from a health department perspective. They were a very small health department, but they did so much. One of the things that I did for them was created a monthly newsletter, a monthly health and wellness newsletter that went out to over 300 county health employees. And I also did lunch and learns, and I really love to do those. So we talked about recycling and why it's important. And I also did pool inspections. I did housing inspections. I learned about so many different aspects of public health. It was a great experience.
Yeah, that's pretty cool to be able to have that experience while you're in college and building your resume towards your first job out of college.
Yes.
At the Marin County Public Health Department in Indianapolis.
Yes.
What did you do while you were there?
Yeah, so my first job out of college with the Marion County Public Health Department in Indianapolis, Indiana, I was an environmental health specialist. So that was a really nice word for a pool inspector. And I actually had a great time. That was probably one of the funnest jobs I've had. And so we would test the water quality of pools that were public and private pools. So maybe your LA Fitness or your YMCA or other community center pools. And we would submit it to the lab to make sure that it was quality water and that also those people who were running those pools were running it properly, proper chemicals to keep it clean and healthy for people to use. I also did some more water quality things by testing our lakes and our rivers, doing macroinvertebrate collection to make sure that our waters were healthy and drinkable, etc.
That's pretty cool. Did that, got your experience in the fancy word for pool cleaner and inspector. Then you were able to move on and within the same company as a community health screener, and you were able to do that for 8 months. What did you do as a community health screener, and what all does that entail?
Yeah, so I entered that organization the first opportunity I got, and then I was able to accelerate to a new position that was actually included benefits. So that was great. As a community health screener, we did vision and hearing screenings for children first grade to 12th grade. And we would make sure that they could hear and identify any vision or hearing problems, which there were. And we would send references or referrals to the parents to see a doctor for their child's vision or hearing difficulties. So we did that, and we did provide education to staff on the importance and parents. So that was a great opportunity.
Yeah, that's pretty cool and was that in the school systems or was that somewhere at the different locations?
Yeah, so we tested all the schools in Marion County. I believe that's a law that all the schools, first to 12th grade students have to be tested unless the parents choose to opt out. Most parents did not because there was a lot of kids that we did, I wouldn't say a lot, but there was kids that we did identify as having vision and hearing challenges. Mm-hmm. And that really helped the teacher understand, okay, that's why the student isn't really participating or really isn't able to have the good grades. And now that they have identified that, those students' grades probably will increase and improve.
Yeah, absolutely. And then you moved on to the chronic disease health educator and communication specialist. Mm-hmm. What all does, I know the chronic diseases and we're learning about them in health class currently. So that's pretty exciting to talk about with freshmen in high school. What, as a communication specialist and chronic disease health educator for them, what were you able to accomplish as far as programs wise?
Yeah, so as a chronic disease health educator, and then the communications specialist was a separate piece of that position. Okay. So much fun. As a chronic disease health educator, I really helped that department with most of their, if not all, their chronic disease programs, such as the cardiovascular health, tobacco cessation, nutrition, physical activity, and sodium reduction. So with the tobacco cessation, I was actually the chair of Smoke-Free Indy, whoop, whoop. And that was an amazing opportunity to educate Marion County and the surrounding cities about tobacco cessation, secondhand smoke, third-hand smoke, implement tobacco and smoke-free policies for schools and campuses in that county and surrounding counties, and just really do initiatives. So we partnered with Truth Initiative and we did some campaigns with them, which was really awesome. As the communications strategist or communications individual for that position, I helped the actual organization, Marion County Health Department, gather different media information from those different programs to put out in the community. So we did different media releases about chronic disease. I also handled our social media and also wrote like letters to the editor. So it was a lot of those different pieces that tied into that communications role.
Right. And then we kind of talked about before we started recording, but you moved down to Nashville.
Yeah. Okay. Nashville first.
And took a job at Vanderbilt University as the director of communication or community outreach at the medical center there at the university. Kind of going along that path, how did you choose to kind of look and apply at a university job versus the community jobs that you had been doing?
Yeah, so I want to clarify too, Vanderbilt University and their medical center, they split in 2019. So I worked for the medical center, not the university side. Okay. Right. But they were once together. But applying to the medical center, that job actually spoke out to me in a way that I was thinking I wasn't good enough for that position. I almost did not apply. And I believe they call that imposter syndrome. So you know what, I just thought about it. I looked at the description and the requirements and I applied for it. 7 days later, I got the interview and 7 more days later, I got the job. And that communications, the community outreach position really spoke to me as an individual because I really love connecting people to resources. But that position mainly was, I would call it grant writing and development.
Hold on. I got a class coming through the hallway.
No problem. And I can restart that answer.
Yeah, I'll restart the question on that for you.
Okay.
There being freshman, PE freshman.
No problem. Have you ever heard of the program called Descript? I just started using it, and it's a very easy program to edit your videos and also transcribe the information. It transcribes it for you. I'll send you
Descript.
the description. Yeah, it's really cool. I'll put it in the chat.
Perfect. Yeah, I use Adobe Premiere Pro, I think, just from the school. We used to have Apple. Oh, they left the door open. Hold on real quick.
No problem.
It's a security door, so it beeps if it stays open.
No problem at all.
Oh, fun working at the high school today. It's that you can definitely tell it's the end of the year. All the kids are going crazy.
Yeah, I remember those days.
Oh, all right, so we'll just start over at the director of community outreach.
Okay.
So then in 2019, you took a job as the director of community outreach at Vanderbilt University Medical Center. How did you kind of pick to apply for a job at a medical center when you had been working at community jobs as a different kind of a role for you?
Yeah, I actually just came across it on Indeed, and the funny thing is I honestly hadn't even heard of Vanderbilt University prior to my time in Tennessee, which was pretty funny. But I looked at that job description and it really spoke to me as an individual and what I wanted to do when it came to connecting individuals to resources. But I would consider that position more like grant writing and development because I wrote about 18 grants a year. And I also oversaw contracts and did some poison prevention presentations statewide. So it was a lot more of that. And I found it to be really rewarding, understanding the ins and outs of grant writing. And I did some grant writing for other organizations in the past years as well. So I knew some techniques on how to, accelerate with the grant writings and contract management.
Okay, yeah, that's pretty cool. So you were the liaison for, I think, 95 different counties in Tennessee, and that big population. How were you able to take what the medical center there had to offer and share that information with everybody that could use it and benefit from it?
Yeah, so it took a lot of effort because I was a single person doing that for the entire state for that program. But we really utilized our partnership with the University of Tennessee Extension educators, and there's an educator in all 95 counties. So when there was a presentation across the state where I couldn't happen to travel to, I would connect with that educator and they would provide that presentation. Also, we would mail resources statewide. And that includes poison prevention information, stickers, magnets, other resources that are essential for families to prevent poisonings like cabinet locks.
Right. Yeah. And getting that, I mean, my kids just had their birthdays recently and they're 8 and 5, but I remember being a new parent and not really knowing exactly what to do as far as how to prevent them from doing all that kind of stuff. So that's really important as far as the poison control and getting those doors locked.
Yes.
So then with Jenkins Public Health Consulting, you're doing that full time now. Like we said, you started back in 2018. What are the things that you offer for your clients, or who are you kind of targeting as a potential customer?
Yeah, so I'm targeting nonprofits and for-profits with a chronic disease, injury prevention, or wellness program. I'm also really wanting to work with those who, the HR system within an organization for employee wellness, how to get those employees more involved, how to do engaging wellness programs with engaging or, incentives that really get them to participate. I'm also doing trainings on professional development, coalition building, and outreach strategies. I believe it's so important for nonprofits to have a coalition and to bring together different organizations to help them implement their program goals. And so I do trainings on that and also professional advancement for those who are current or aspiring public health professionals. So I do that for schools, colleges, high schools, any students or class that are promoting students to get in the field of public health.
Okay. Yeah, that's pretty interesting. I mean, like a healthcare careers class like this is being shown
Mhm.
for my school, and other kids that are interested in, getting into public health or getting into a healthcare career job.
Mhm.
What are some of the things that they can kind of be focusing on as far as high school students? We're going to just kind of jump a little bit and
Mhm.
some advice for that age group. If you think that somebody that thinks that they're interested in becoming a public health, what is something as a high school student they can kind of be targeting or looking at doing to get involved in learning more about public health and what they could be doing to make sure that's a career path for them?
Yes, and you said a key word, to make sure that's the career path for them. A lot of times people think that's something they want to do, and then they'll go from high school to their PhD and then realize, oh, now that I'm in the field, I don't really want to do this. So I think it's really important to do a lot of job shadowing. You can do that at your hospital, your local hospital, a health department in your local area, and they're happy to have someone on their team who's going to help them with some of their tasks. Also, I would say to volunteer in the areas that is directly related to what you want to do, and that's public health or healthcare. And I would say doing that at the American Red Cross, a food shelter, a women's shelter. Look up those different locations and resources in your area and see if that's something that you want to do and how that aligns with your long-term goal, which would be public health and healthcare. Um, Also, I would say just network. You want to make sure that you're connecting with people who are already in the field, or there's someone your parents know, whether it's your church leader, etc. What really got me into public health is at the time he wasn't a pastor, but currently he's a pastor. His wife was a pediatric nurse or a doctor, and she let me job shadow her while I was in high school. And I was able to look up those pediatric babies, and she talked about their care and everything, and that really got me interested in the field of healthcare.
Right.
And then going forward, I went to Indiana State, Ball State, went through the whole career. And so now this is where I am when it comes to really wanting to make impact in the community. So definitely job shadow for sure.
So then jump forward a couple of years. Someone, let's look at it like a sophomore, junior in college that decides public health is the right career path for them. They've done the job shadowing, they're taking the classes, they're enrolled in the college. What
Mhm.
advice would you have for them as far as experiences to look for, or maybe part-time jobs that would be
Mhm.
beneficial for them?
Yes, I would say number one, everything needs to align with your end goal, with that job that you want to work with. You might not know the exact position, but it should align with public health. Like being an accountant, but you want to work in public health, those don't align. So making sure any job you work in, whether it's part-time, full-time, or free, it should align with public health or healthcare. I would also say doing an internship is very important because that's a 3 to 4 month requirement or longer, depending on their requirements. That really gives you an in-depth experience on what public health is, and it gives you some even skills and competencies that you learn to help you get that job position after college. And again, like I mentioned before, networking is number one. A lot of the people that I met helped me get into the doors of where I am today as a business owner and the director level position that I had in the past.
Right. Yeah. So then somebody that is, getting ready to graduate, maybe they're getting their undergraduate or their master's in a public health type of related field. Um,
Mhm.
they're looking for a job. They're getting ready to apply for jobs. They're 3 to 6 months out from graduating. They're getting kind of antsy, ready to start their career future. As far as applying for jobs, resumes, that kind of stuff, what advice would you have for them to kind of hone in and focus on when
Mhm.
looking for a job in that sector?
Yeah, so I would say definitely make sure that you're applying prior to graduation, whether it's 3 or 6 months out. Apply to jobs that interest you, because I know that you can get hired prior to graduation because I was one of those individuals. So I would make sure that you have a results driven resume or CV. It's a curriculum vitae. And the difference between a resume and a curriculum vitae is a curriculum vitae is more than 2 pages long, and it's a historical view of your experience in the field. And that's whether it's paid or unpaid experience. It includes any programs or affiliations that you're a part of, like a coalition, anything like that, any projects that you've done, etc. So I would make sure you have that results-driven CV. Also, make sure that you have that job description aligns with your resume. So you have those keywords on your resume. And then just apply. Even if you don't feel like you qualify for that position, even if it's asking for 3 to 5 years of experience, apply. You may not know how much your resume stands out to that hiring manager.
Yeah, I like that a lot. I think that, your experiences as you build them through high school, college, and then continuing on to your first job, I mean, could be 4 or 5 years of experience right there with all the volunteer work that you've done and
exactly
part of all the other programs.
Yeah.
Now, jump forward a little bit, about a year past there, advice for a person that is 3 to 6 months into their first job in health. So, they're learning all the policies and procedures of the company. What advice would you have for them as far as things to kind of focus in on or people to look up to?
Yes, so I would make sure that you know what the expectations are in your position within the first 90 days. Like, have a clear understanding with your boss, immediate supervisor, of what they expect from you within the first 90 days. Okay, so are there any big projects or metrics that you need to meet? Because if you're not clear on those things, it could lead to like a bad annual performance review. So we don't want that, right? We want to make sure that we're in line with what they hired us to do. And if it's not clear to you, continue to ask for clarification, because that should be clear to them to give to you. I will ask, about any challenges, or go to your supervisor about any challenges where you're not understanding something or you're not really catching on to their program requirements. And that's okay. It's rather to ask for help than to, mess up and then try to fix it later.
Yeah. So then a part of your consulting business, some of the things I was able to find on your website as examples of what you're able to do, you talked about your mentorship program a little bit. Can you talk to us a little bit more about what that looks like and how long it is and what you kind of do as a part of that program?
Yes, so that program is like a subset of Jenkins Public Health Consulting, and I get so excited about it because I wish I had a mentor like me when I was in high school. Maybe I'm hyping myself up, but I really think I provide a ton of resources to individuals who are current or aspiring public health professionals. So we spend 4 weeks going over public health topics, 16 plus public health topics, covering career advancement, professional development, etc. I provide worksheets and checklists, etc., for them to really understand what their short-term goals are, long-term goals, and how your actions now lead you to those things.
Right.
So we're talking about CV and resume, a results-driven CV and resume, standing out as the ideal candidate. Let me see, can't even think of all the topics off the top of my head, but 16 public health topics. And I think it just really helps them to become the person that they want to be in the field of public health. Yeah,
absolutely. And then as far as some of the strategy sessions and community outreach, workshops and trainings, and also grant support and proof and editing. So kind of just really working with those clients and helping them with their company and build it to where it'll be a successful program.
Yes, that's just so important to me. If you read my about page, my grandparents really introduced me to helping people. Number one, it wasn't necessarily public health, but it was really to help people and giving back. And I think number one is where, making sure that when you're at organization at community outreach events or health fairs, not just sitting at the table and expecting people to come up to you, but getting from behind the table and engaging with those individuals, making sure they really understand what hypertension is, making sure they really understand how to access your resources after they leave, right? We can't assume everyone has a telephone or transportation or even speak proper or clear English or understand English. So we need to be that intentional resource that connects them to your program. And those are some of the things that I do. With grant writing, I love grant writing. I've been a grant writer for probably 10 years now. And I really prefer to help people get that application where it needs to be, meet the requirements of that grant funder, and stand out every single time. And even when you have the best grant applications, sometimes their priorities are what they are. but submitting a great one every time is just so important, and they'll think about you afterwards.
Yeah, I really think it's really important to make sure that yours is written right and in the place to be able to stand out and get remembered for future grants as well.
And that you're meeting the requirements that they ask of you. There's nothing you can skip in a grant application because that knocks you out of the running.
So as far as a perfect client or a perfect company that you would want to work for, what does that, or to bring in and consult for, what does that kind of look like as far as a new client coming in and working with you?
Yeah, so when a new client comes in and works with me, I like to get all their information about the organization, all their information about what their outcomes and their goals are for their program. What are their challenges, and why do you feel like I can be helpful to your organization? What about me or my business services has stood out to you to reach out to me for help? So really outlining those key pieces to understand what their goals are and how I can help them reach them. And then the strategy session is what we do, which is so key because I need to look at everything and see what your challenges are when it comes to connecting with your target audience.
Yeah, I like that. So then we kind of talked about misconceptions about public health a little bit earlier, but as far as misconceptions with working with a consultant, what have you kind of seen so far as companies, what do they think a consultant would do for them, or misconceptions they might have about what you provide?
Yeah, so I would think that I haven't come across those misconceptions from a company standpoint, but I think sometimes people expect you to have the answer for them. And it's really, we need to come to an answer together, right? I can't pick up the CDC and say, hey, I know the answer to all your challenges. We need to have an in-depth discussion about what your challenges are and how we can achieve the goal that you have in mind. So really working together to overcome those challenges. I would say outside public view of a consultant is that you have to have all 95 degrees and certifications to be a consultant. And I think it's more so about your experience in the field and definitely having some certifications and degrees behind your name. But to be honest, I believe I have a lot more experience than some people with the MPH, and that's okay. It's more so, how can you provide this goal or help me achieve this goal and get me to where I want to be when it comes to the organization's success.
Right. Yeah, I think that's really important also. As far as you kind of mentioned the CDC there, and I know that they kind of set the industry trends or the leading experts, I guess, if you will. What have we, past COVID in the last 2 years, what are we kind of seeing as far as industry trends from public health?
Well, yeah, the industry trend is COVID-19, really getting people vaccinated and educated about that. That isn't really my forte. I know chronic disease is a indicator or underlying issue with those who died or had complications to COVID-19. So I really stay in my field when it comes to educating people. But the trend really has been that COVID-19 education and getting people vaccinated nationwide.
I feel like, and I've talked to some other people, but I feel like mental health is also another big trend right now.
Yes,
as far
totally.
as health.
Totally, yes.
And so you kind of talked about industry or professional development also. What are some of the professional development things that you like to learn about and to do as far as keeping up with your credentials and license?
Yeah, so I always try to do what I can to network. And like I said, joining professional organizations like the NSOFI or SOFI, also coalitions, any coalition that speaks to your long-term goal in your community or a national coalition, that's super important so that you can network for opportunities that might be outside your state, right? Who's to say that you want to stay in your hometown and work? There might be opportunities across the country or globe. Also joining professional memberships, right? And that also helps you stand out as the ideal candidate during your interview process.
Yeah. So far professionally, you've been in this industry a while now. What are you kind of most proud of being able to achieve?
I'm sorry, you kind of broke up a little bit.
Yeah. Just said, what are you kind of most proud of being able to achieve so far? Working in this industry for over 6-7 years?
Yes, so I'm most proud of really just meeting people all over the country. From me and my husband moving from Indianapolis, Indiana to now Birmingham, Alabama.
Right.
And also my mentor program reaches people from all over the country. I've served people in West Virginia, California, Arizona, Ohio, and so much more. So it's been a pleasure to really connect with different people with different needs and views, and that led me to opportunities, right? My mentees also teach me things as well. So that's really been the biggest highlight of my career thus far.
That's pretty cool. So the flip side of that is 10 years from now, setting career goals and looking at what you want to be able to achieve down the road. Where do you kind of see yourself professionally 10 years from now?
10 years. 10 years from now, I see myself having some staff members, also having interns, having a separate office space so I don't hear a 4-month-old baby in the background sometimes. So also working with those big organizations like the CDC or the FDA. And really, honestly, I would love to crush working with local health departments. Those health departments have amazing, amazing life-changing resources for individuals that most people don't even know about, and they're all free. So I really want to help health departments get their message out to people in their local area about the resources that are available to them free of charge.
Absolutely. As far as resources go, do you have any books that you might recommend to a high school or college age student that thinks they're interested in getting into public health?
A public health focused book?
It doesn't even necessarily have to be public health focused, but one that you think would kind of draw somebody into that arena.
The book I would say that I'm currently reading is Life is What You Make It by Peter Buffett. And it really talks about how we have to treat everyone the same, no matter if they have a lot of money or seemingly have a lot of money or not a lot. So that's the book I'm currently reading. And it really has helped me understand, again, those kind of like biases and stereotypes in a different way, and how we should be helping people no matter what field we're pursuing.
Yeah, I think that fits in really well with that public health and just the helping in general of the community members and people that are surround you. So this is kind of a two-part question. It's if you dislike and if you like blank, then working in public health is not for you. And we're going to go with the if you dislike first. So if you dislike blank, then working in public health is not the right career path for you.
Okay, I would say if you dislike presentations or people, public health is not for you.
Yeah, kind of interesting. A lot of the people that I talk to is if you dislike people or being around people, because communication has been played such a big role in a lot of the healthcare careers, and just being able to talk to somebody and give them the information and help them with the issues that are going on. So I think that especially with public health.
Exactly, yeah.
And if you dislike blank, then if you do like blank, then working in public health is the right career path for you.
If you do like creating initiatives or programs, public health programs, I think public health is for you. There are so many unique programs that you can create that are fun, engaging, interesting. I think that will make public health for you.
I like that. And then do you have a life quote or a mantra that you kind of like to work your life through?
Yes. And I tell people this on a regular basis. Worry stops where faith begins. But I came across that quote years ago when my sister passed away. And I had to stop worrying about my next steps because she was such a mentor to me. And when I started to walk in faith and not worry, that really helped me with my next steps and my confidence in being courageous.
Yeah, I like that. I mean, by being able to focus on you and stay in your path and contribute, that's a good thing. A lot of people. So if there's anybody that's interested in getting in contact with you, do you have any social media channels or websites that you'd like to say so that people could reach out to you?
Yes, you broke up a little bit, so you might want to repeat that because I know what you're saying.
All right. Yeah, absolutely. Is there, if somebody's interested in getting in contact with you, is there any social media or website channels that they could get to contact you about your company?
Yes, absolutely. Jenkins Public Health Consulting, you can Google that, or my website is www.jenkinsphc.com. You can follow me on Instagram at Jenkins_public health, and you can also follow me on LinkedIn, the Jenkins Public Health LinkedIn page.
That's awesome. Well, thank you so much for spending this time with us, teaching us about public health, and we really appreciate what you do for your community and what you're able to knowledge to give to the future students.
Yes, of course, no problem. Thank you so much for having me. It's been a pleasure.
If you've made it this far into the episode, I want to thank you again for watching. Please subscribe, share, and comment below with any questions or comments you may have. If you're interested in more information about other professions within healthcare careers, please visit healthsciencecoach.com and talk to your school counselor or academic advisor. As always, stay happy, healthy, and live life with passion.